Hello. It's Dr. Amina Goodwin Fernandez here, the infectious doctor, and I am coming to you with a little informational video, well, presentation, I should say, um, based on questions and DMs and texts, etc. I have received. I decided to do a video just kind of answering some of these questions. I haven't done a video in probably about 2 months, and I felt like maybe people are getting tired of COVID, but then because I'm getting questions, I guess there's still a lot of things concerning and worrying people, so I figured I should just address them. Now, just a little disclaimer, I don't give medical advice. Everything I say is basically my opinion, general information. Nothing I'm saying is representative of my employer or any organization of which I'm a member of. So it's just my personal opinion, not medical advice. For any advice related to your specific situation, make sure you speak to your specific medical provider, okay? So what I'm going to talk about includes the following. Basically, factors impacting whether or not a person acquires COVID-19 infection. That's number one. Number two, different aspects of prevention of COVID-19. Number three, what to do if you get COVID. Number four, I'll say a bit about face masks and about gloves and about those face shields as well. And then I will also talk about whether or not you can get COVID more than once, and the vaccine, and then just give an overall summary, okay? So first things first, what goes into whether or not somebody gets COVID, right? There are essentially multiple factors at play. So there are factors related to the virus itself, and then factors related to the host, which would be us, the human host, right? So when it comes to the virus, it has to do maybe with the strain. Sometimes viruses have different strains, and different strains are more likely to cause severe disease than others. We see that with influenza, and there are many other viruses that we see that with. It's probably not yet determined whether or not, COVID has some strains that are more severe than others, etc., right? That's still, I think, or at least I'm not aware yet of that delineation between severe and less severe strains of COVID-19, okay? Then the other thing as well with relation to the virus is basically the degree of exposure or the dose of the virus. So is it that you were really, well, either maybe living with somebody who had significant infection, pneumonia, and things like that, and they were really letting out a lot of virus into the environment? Or was it that you maybe just happened to pass by someone just as they coughed, and you weren't hanging around them for a prolonged period of time, so you sort of transiently got some virus and it was enough to kind of take hold in you and give you infection, right? So the dose of the virus. Now looking at exposure in terms of the activity of a person, for sure, a sneeze is going to result in much, much, much more virus being expelled compared to a cough, right? And then just thinking about it from a common sense standpoint, a cough would probably result in more virus being expelled than just simple talking. Maybe shouting and screaming or maybe singing at the top of your voice might have more exposure compared to simple talking. But certainly you would expect the highest exposure to be from sneezing, like a nice big sneeze, or a cough, like a nice strong cough, compared to just simple talking. So in the beginning, we heard information about how singing in a choir and so on resulted in spreading virus, and then the fact that just talking can result in spreading or expelling virus. But you just have to think about the degrees or the amounts of virus based on the different activities. And, like I said, it's many different factors together. So even if you get exposed to a large amount of exposed to a small amount of virus, it is quite possible that you can still end up with severe infection based on factors now related to you, the host. And what are those factors? Well, number one, the big one we've heard of is age. So the older persons potentially being more susceptible to severe infection, serious infection from COVID, compared to a younger person, a child, or maybe a young healthy person in the 20s. So age is one factor related to the host. Number two would be the strength of the immune system of the host. So somebody who has a nice, robust immune system may potentially not have very severe disease compared to somebody who has a very weak immune system, may be wiped out from chemotherapy or whatever other reason, maybe advanced HIV disease or something like that, right? So the immune system is another host factor. Another one is nutritional status. So a very malnourished person might just be too run down in general to be able to fight infection compared to somebody who's nicely nourished, not really deficient in any of the major vitamins, good protein levels, etc., right? And then lastly, for the host is, different genetic differences in people. Maybe people might have some genetic predisposition to infection, just the different we all have a different genetic makeup, and there are certain things maybe with the genetics that could potentially cause somebody to be more prone to infection than others, right? So those are the factors related to the host, which contribute to acquiring infection. So it's factors related to the virus, whether strong strain or weak strain, right, or the amount of virus you're exposed to, or the host, age, immune system, nutritional status. Those are the those are the factors related to getting infection. So basically, it's an interplay of all these factors together, which determines whether or not somebody gets COVID-19, and if they get it, how severe it is. So that is why it's so hard to predict, who is going to do badly, who is going to do poorly, etc. Now, you can have a 90-year-old who is very healthy, very active, strong, physically fit, etc., no nutritional deficiencies, and they can be exposed to COVID, get COVID infection, and have a mild case, compared to, for example, somebody who's 25 and they weigh 300 pounds and they have medical problems and their body's just not in the best position to fight off this infection, and so they can potentially get a severe case of COVID and end up even succumbing from it, right? So it's really hard to say specifically, okay, this group, absolutely every old person is going to get a severe case and there's a high chance of dying. You just cannot say that, okay? Now, preventing COVID. So again, different aspects of prevention, and it's basically everything together, right? Now, we've been dealing with this whole situation now for what? Maybe more than 6 months, since about February, March or so. And we have been through all these lockdowns, etc., etc. But now we realize that, a lot of us realize, I guess, that life kind of has to go on somehow. We cannot remain totally locked down forever. Children have to get back to school and some people have to get back to work, etc., etc., right? So basically what we have to do is our best to prevent infection, right? Well, I've been saying before that we should try. I feel like we're probably all gonna end up with this, eventually. Maybe not, but who knows? But anyway, we need to make ourselves the strongest possible hosts, as in try our best to optimize our nutritional state. If we have any chronic medical conditions, try as much as possible to keep those optimized. And then just try not to hammer our bodies with toxins, cigarettes, alcohol, other recreational drugs, etc. You just don't want to stress your body with all these toxic chemicals, and so that you allow it to use all the energy to fight any potential infection that you could be exposed to, right? So preventing infection, different aspects. One, distance, not being in close proximity to potentially infected persons, right? Now the fact is, we know that there are so many levels of severity. Very many people, probably more than percent of people, 50% of people being infected have mild cases, very mild symptoms, really hard to even determine that they have infection, right? So you really don't know what is what. And so if you, for people who, if you're like fearful or just really can't afford to get this infection for whatever reason, then the best thing is just to stay not in close proximity to people who you don't know what is going on with them, right? So do as much as you can at home. Maybe older, very vulnerable people, just really not trying to get out, not going to movie cinemas, not going to bars, just people in general just not going to bars, or just areas where there are crowds, especially when it's enclosed and so on, right? So trying to maintain that physical distance is probably number one, in terms of importance, right? Now, if you do have to get out there, which is most of us. You have to go to the store to buy your groceries, the pharmacy, etc., etc. So if you do have to go out and maybe come in contact with people, just not being in contact with people for excessive periods of time. Um, this thing tends to get out. Anyway, so like for example, if I have to go to the store for something, I pop in, get what I want to get, I know what I want to get, and then I pop back out, right? You go to the supermarket, you quickly get your groceries, and from personal experience, it's easy to go to the supermarket and really not come into 6 feet of people. And if you happen to pass somebody along the corridor, it's very transient. It's for a few seconds as opposed to, lingering. You really have to be within somebody's physical space for at least 15 minutes, if not half an hour, to have enough time to breathe in, virus, breathe in the air that could be potentially infected with virus from them, right? So the time you spend, minimize the time you spend with potentially infected persons, okay? Hand hygiene. I think hand hygiene is the number one most important aspect of infection prevention. So you might, not be close to people, you might not be hanging out with them, but then what if you go and you're leaning on a counter, or you're touching doorknobs, or you're touching, the handlebars for the shopping carts, etc. So you don't want to be in a position where you're not sanitizing your hands or washing your hands frequently, and then you're like inadvertently touching your face and contaminating your mouth or your nose or your eyes, right? So that is the importance of hand hygiene and frequent hand hygiene. Personally, whenever I touch anything, any shared surface, if I touch a doorknob, or if I happen to lean on a counter, or use one of those signing things in like an office where you have to go and sign something or whatever, then I always have my hand sanitizer in my pocket, and I take it out and squirt it on generously, and I just rub it all over my hands. So I think hand hygiene is the single most important aspect of infection prevention, just because we all unconsciously touch our faces multiple times per day. And so if you engage in hand hygiene frequently, then you minimize the contamination of your hands, and so therefore decrease the chance of getting infected. Okay? Now, personally too, I should say about the whole exposure thing. I think it depends on the level of risk. Now, some people are more willing to take risks than others, and that is fine. Risks all aspects of life, people decide whether or not they're taking risks. People decide to take a risk, you go for your surgery and they say, well, we're trying to fix this, but then there's also the risk of bleeding, infection, death, and so you weigh everything together and you decide, okay, well, the benefits for me outweigh the risks, okay? And benefit with risk, ratios vary depending on people, age, situation, etc., right? So you basically weigh your risks. Also, you probably can keep an eye, or like sort of pay attention to what the situation is in your area. So if there's rampant spread of virus throughout your area, then you might say, the chances are a little higher, so maybe I might not be hanging around, in the store too much. I might buy as much as I can on Amazon, so that I only have to spend short amounts of time in the supermarket, etc., etc. Okay? So that is a little bit on just each individual weighing risk. Now, moving on to masks. So there's a whole big thing about masks. Now, the whole thing is that everybody, I guess it's like mandatory for everybody to wear masks, whether or not you're in healthcare. I will say I totally agree with wearing masks in the healthcare setting. I examine my patients. I sometimes get up within 1 foot of patients. And of course, a lot of our patients are quite vulnerable, older people and so on. And so obviously, it's just not, right, especially in these times. We used to do it before, but with everything that's going on now, just getting up so close to people, it's just not, right? And so I absolutely agree that us in our healthcare setting, taking care of our patients, it is totally appropriate for us to wear properly fitted surgical masks to decrease the chance of us giving our patients anything or getting something from our patients, right? But now the big thing is that everybody should wear a mask, and not necessarily a mask, but a cloth face covering. And I really don't see, if we're focusing on physical distancing and hand hygiene and so on and so forth, I am really not sure how much cloth face coverings are going to offer. especially because half of the time you see people with either mask or cloth face covering and they are not even worn properly. We know, I mean, all of us, most of us, many of us realize that these face coverings are actually quite uncomfortable. It's not like, oh, it's just not natural. So it's uncomfortable to be keeping these things on for prolonged periods of time. And so I definitely understand why people would just have it over the mouth, loosely, nose exposed, right? Obviously, that doesn't really do anything, right? The whole thing about these face coverings there is that they block the obvious large droplets. We're speaking and, maybe little things come out that you can actually see. So the large droplets are blocked. But those microscopic aerosols, really and truly, I just cannot see how these face coverings are going to prevent, spread of those, because these are microscopic. And so, of course, the cloth and maybe even some masks, surgical masks, depending on what they're made of. I mean, there are spaces in these things, and so microscopic particles, which, for these viruses, you literally have to look under an electron microscope to see them. And so, obviously, something that's microscopic is definitely going to extrude from, through a cloth face covering. So, I just cannot comprehend personally how we got to this stage where it is mandatory for these cloth face coverings, because I cannot see how they prevent infection or virus from spreading out. Okay. Specifically on the CDC website, I know they say that face coverings and face masks are not a replacement for physical distancing. So, this whole thing about, maybe being close, in the cinema or at a game or whatever, you're close, and really and truly the face covering is not going to offer you any benefit, because whatever people breathing out and so on, and you're close to them, and so, even potentially droplets, depending on how loosely these things are, can escape, and so you could still be at risk of exposure. Now, the other thing that I have been wondering about is the fact that these face coverings, especially, cloth, maybe surgical mask too, because my surgical mask gets moist, but face coverings and these things, they get quite moist. And what if the wearer of the cloth face covering is actually infected? And so their secretions or whatever coming at the mask have virus, and so you have this mask that is getting increasingly moist as the minutes go by, and potentially if they're infected, then you have virus on the mask or the cloth face covering, and you're keeping this thing on for hours, right, if you have to go to work. And so potentially you can have ongoing replication of the virus on this moist face covering. In the beginning, when masks were advised against, right, for the general public, one of the main reason was the fact that the mask gets moist as time goes by, and the fact that masks were not recommended to be worn for more than 20 minutes at a time. The recommendation at that time was that if you were going to wear a mask for more than 20 minutes, you had to change it, right? Because of this moisture, which could potentially, increase risk for infection. So my thought has been that, people are keeping these masks on for hours and hours and hours on end. And then if the wearer of the mask has infection, and then the virus gets out onto the mask, and then they're talking and breathing out and so on. And so because the virus is microscopic, what if you have increased shedding of virus as the hours go by because your mask is so contaminated, right? So these, I just wonder, maybe what if by chance it's causing more harm than good, right? So, I don't know. Personally, when I put on a mask, my nose runs for whatever reason. I'm not sure why. I know I've heard other people say that as well. But because I wear a nice, snug, tight mask, it's not like I can take it off easily to wipe my nose. It's just not feasible. So it ends up being a little on the gross side. Also, as time went on, after the start of this pandemic, I noticed that my voice was getting more and more hoarse, and I was like, is it the mask? Because I noticed it started around April, May. I was just getting more and more hoarse, and I was like, not sure what's going on here. Anyway, I did take 3 weeks off from work, and my voice came back to normal. I came back to work last week, and before the end of the week, my voice got hoarse again. So my conclusion is that for whatever reason, I don't know why, but it seems like wearing the mask causes me to be a bit on the hoarse side. Now, fortunately, I'm not a singer or anything like that, but I mean, I'm just saying that you can have little issues related to mask wearing, right? Another thing as well is the irritation of the skin. I guess maybe I have, like, I don't know, excess hair on my face or whatever. So have little bumps forming just because you talk and your face moves up and down with the mask on, and even have a little irritation on my nose as well. So you have these little issues, which may be cosmetic, but still, all these things kind of add up. And so I personally understand why, people would not be too enthusiastic about keeping these masks on for hours and hours on end, right? One thing about those vented masks, I am very, very, very happy that those have been banned, at least in public areas like planes and so on. And I think I try to not go very close to people in those vented masks, at least for prolonged periods of time. I was, in contact with somebody who wears a vented mask, and literally I saw drops of, I guess, water or fluid, condensed fluid, dropping out of this vent. First time I saw it, I wasn't sure. I was like, did I just see a drop of water drop out of that thing? And then I noticed it several times, during the course of the person talking. And so what happens is that it's moist. The air that we speak out, the moisture from our bodies comes out. And so you have condensation occurring in this vent. And then it builds up until you have it there like drops of water, fluid, and then it drips out. So theoretically, if somebody wearing one of these things is infected again, and so that fluid is teeming, what if it's teeming with virus, and then they're talking and then it's like spewing out, splashing out intermittently. Not a good situation. Very unnerving, to say the least. And so I'm glad those masks were vented. But that whole condensation thing with virus and potentially being more risky, that's my same thought about just a regular face covering, because you have all this moisture, maybe virus, and then you're talking and this thing is not, these microscopic things can come through the fabric. So I don't know. I just think we're focusing on the wrong thing, to be honest. We should focus on hand hygiene and then that distance, physical distance, right? What about face shields? I see a lot of people wearing face shields. I did travel some time ago on the plane. Some people wearing these face shields. And I feel like it's basically a false sense of security. Maybe the large droplets, we wear face shields in the hospital setting. You're going to be doing a procedure and you're really going to be leaning up, and there's a potential for a lot of splashing. Or if you're dealing with somebody where you're doing a procedure in the mouth or nose and you feel like there's a high chance of them sneezing and really coming at you like that, then the face shields are what we use in those situations. But for the regular layperson on the street having these face shields on, I mean, you really shouldn't be that close to strangers where they can potentially be coughing at you. And if it's just regular aerosols, those microscopic particles, those are going to come around the face shield anyway. So it's really not offering you very much, right? So I feel like, I mean, if you want to wear a face shield, I think everybody has the right to make their own choice, what they want. I'm all for personal choice, but I don't feel like it's really doing much in terms of preventing COVID infection, more so than the distance and the hand hygiene, right? Gloves. People wonder about gloves. Somebody asked me about gloves. They go around and they wear gloves, etc. I see sometimes some older people in gloves. And what I think gloves do, again, for a sense of security, because you still end up touching everything. You're touching your bag. I see people driving and wearing gloves. I see them, flipping up the sun visor for the car, and then they're driving and they're touching everything and they're scratching and touching and so on. And so that's basically defeating the purpose, because, I mean, if you're thinking maybe you're going to sanitize the gloves, well, the alcohol probably will break the integrity of the glove. And so, again, it's just going to ruin it. You might as well just focus on sanitizing your hands more frequently rather than having this glove that you're going to be touching up everything with anyway, okay? So basically that's prevention, the aspects of prevention. Maintaining that physical distance, number one. Two, if you have to come into contact with people, try to minimize the amount of time, as little as possible, to be in contact with potentially infected people. Number three, frequent hand hygiene, right? For, I guess, well, they're mandating masks, so I guess, but I don't feel like masks protect me. The whole thing with masks, in the beginning, it was to basically destigmatize it. They recommended for everybody to wear it so that wearing it can be destigmatized for the people who really need to wear it. And then I guess they realized that wasn't helping, so they said, "Oh well, let us, wear masks. I wear masks to protect you." And then that wasn't working because people were like, "Well, I mean, it's not protecting me," because they were stating the mask really doesn't do much to protect you, but it protects the other person. So that didn't work. So now all of a sudden, they're saying that, well, yeah, we think the mask will protect the wearer along with others, and so yes, you should wear the masks. But then they quote all these studies to support it, and when you really read these things, you realize that it's basically a lot of hypotheses and models, etc. And they admit, towards the end of these write-ups, that they really don't have evidence to support masking as a way to completely decrease chance of infection. But they say that studies are needed, etc. But unfortunately, these are being quoted as like actual evidence. So I don't know how we really got there. Also, this last study I saw was about the fact that they're saying that wearing a mask decreases the dose of infection that you will get, and so therefore it will decrease the severity of your infection because you just get a small dose. But like I said in the beginning, there's so many different aspects of that determine the severity of infection, not just the dose of the virus, but basically the host, the strength of your immune system, and age, and nutritional status, etc., etc. So somebody can have a mild dose, but because their immune system is weak, they can come down with horribly severe infection. And then somebody can have a massive exposure, high dose of virus, all right, but because they have this really robust immune system, nothing happens. And we see that with other infections, by the way. We see it with TB, tuberculosis, for sure. We see that where, two people, get exposed to high dose, and one gets no infection and the other one does because they're on some immune modifying medication, Enbrel, or one of those fancy immune medications that people take for rheumatoid arthritis and so on, right? So it's so many factors that interplay. It's not like a black and white situation. And so that's why I think that, we just kind of have to use kind of common sense and so on when it comes to this thing, right? Now, can you get COVID more than, well, first, let me say what to do if you get COVID. So first of all, if you get COVID, definitely have to isolate, quarantine, right? Don't go to work, call in, etc., right? It's just the right thing to do, okay? If a lot of times people cannot quarantine by themselves at home. I have a little son. I know I could never quarantine alone from him. He'll be all around me. So, But anyway, look at your individual situation. And if you can isolate by yourself, fine. Certainly, if you have a very vulnerable person in your house, you really, really want to do your best to just really stay away from them. And if you have to use, like, not everybody has more than one bathroom, and so you have to share the bathroom, but just try your best to, kind of keep surfaces clean and minimize touching other common areas, etc., etc. You just do your best, right? And of course, you will probably or should probably notify your personal healthcare provider to assess and evaluate your specific risk for severe infection and just to get specific advice, right? So you isolate, you don't go to work, etc. Normally isolation is for up to 14 days, minimum 10 days. It might be 14 depending on your situation, but you can find out from your personal healthcare provider and your employer, right? And then some people are not really sick. They can still eat and drink and do whatever they want. Others are unwell, high fever for days and days. And so main thing is to stay hydrated. We can do without food, solid food, or food at all for at least a week more, but not eating food for a week is not the end of the world. So at least maintain hydration. You don't want to get dehydrated, especially when you're having high fever, right? You take, things like Tylenol and so on for fever, and then whatever you can eat, just light, easy things, fruit, soups, warm soups, teas, and things like that, just to soothe you until you feel like eating real food again, and then you get back into the swing of things. But generally speaking, everybody should really contact a healthcare provider just to make sure that they know what they need to do. Of course, people who are at high risk for complications, absolutely should contact the healthcare provider. And then if at any point anything that's concerning you, you contact your healthcare provider. If there are any difficulties breathing, chest pain, weakness, feeling like you're going to pass, or just anything at all that's concerning, you definitely seek medical advice. Okay. Right now, there's no specific treatments, like specific medicine to kill the virus and so on and so forth. It's mostly just supportive care, supporting the symptoms until your body overcomes it and you get better. Okay. Can you get COVID more than once? That's a question that we didn't know the answer to. We were hoping that the answer was going to be no, but now we officially know that you can get COVID more than once. It's been described in several cases now, probably maybe a dozen or so by now, maybe more, but you can get COVID more than once for sure. And so, oops, I don't know. Are we going to lock down forever? I don't know, right? So that's basically that. The immunity, the antibodies produced by the body only last for several months. And it's really not a surprise because that's what it's like for the common cold, influenza, and many other infections that you can get more than once. Okay, even things like hepatitis C, you can be cured and then you can get it again, right? So that's the answer to that question. Then the other thing, vaccines. Now, vaccines have been a really hot topic. And a lot of people are holding their breaths for a vaccine because if you listen to the news, they keep talking. They've been talking about this for 5-6 months now about how we're going to get a vaccine, before the end of the year and so on and so forth, so on and so forth. Going to get a vaccine, right? But vaccines, not the easiest thing to come up with. So many other infections that they've not been successful getting vaccines: malaria, dengue, Zika, all these things. Even Ebola, so many of these things you can't get a vaccine because it's just not the easiest thing, right? So I'm not sure if and when we're going to get a COVID vaccine. And if we do get a vaccine, you have to remember that, we have 7 billion people in the world. If you get a vaccine, everybody's not going to be vaccinated overnight. Okay, it's going to take, it'll probably take years. Not everybody will probably want it, but certainly it's going to take a long time to get a vaccine because remember, we run out of things like reagents and so on to test for COVID. So imagine the things for the vaccine, the vials and the different components of the vaccine, etc. So yes, we might have a vaccine approved, but everybody's definitely not going to get that vaccine in the beginning, right? The other thing too, we might get a vaccine, but how effective is this vaccine going to be, right? If you take influenza vaccine as an example, that is not one of our best vaccines at all. It's not that effective, and it's kind of hit or miss, every year depending on, the predominant strain, etc. So we still have people getting vaccinated for influenza and still end up getting severe influenza infection and dying, right? So we don't know if the COVID vaccine is going to be like that. Hopefully it's going to be better, but the fact is we don't know. Then also, okay, we get the vaccine. Is it going to be a vaccine that you get every year, just like influenza, or is it going to be one that you just get once in your life and that's it? Like hepatitis B or whatever, right? We don't know. I'm definitely pro-vaccine. I've gotten all my vaccines. I get my influenza vaccine every single year, even though I don't think it's the best vaccine, but I feel like the potential benefits to me outweigh any, risk. I don't think it's risky, but it's just that it doesn't prevent infection 100% of the time, and maybe sometimes 40%, 50%, 60%. But I'll take whatever benefit I can get because, I have things to do and I just can't afford to get sick. And if I do get sick, I would like if I could have a mild illness, a mild infection as opposed to a severe infection because, like I said, I have too much to do, right? So I'm pro-vaccine. My son has had all his vaccines as well, but I don't like the idea of things being rushed. And I just hope that I want us to get something that's safe and hopefully effective as well, right? That's what I will say about vaccines. So just generally speaking, I think, the bottom line is that life has to go on, it's understandable why some people, well, certainly because of all, fear mongering in the media. You can understand why people are afraid because if you listen to the news every day, you just feel like, oh my goodness, the world is ending, right? Just because they put the most sensational things in the news. They talk about the uncommon things and so on that are sensational. So it's understandable why people are fearful. Again, I appreciate that a lot of people have lost loved ones as well, and obviously very tragic, people going before their time. I definitely understand what that feels like. And so, it's understandable, but at the end of the day, we kind of have to focus on now as much as possible. Basically, focus on every day and try to do the best we can every day. Sometimes the risks of staying in outweigh benefits of going out for some people. Loneliness is a real problem, and depression and hopelessness and so on and so forth. So, a lot of times people, hear people talking, people judging people. Oh, they're going out and they're going to bars and this and that, and they're spreading infection, and then they're crowding up the hospitals. And now my family member who needs surgery or has to be in ICU for whatever reason cannot get an ICU bed because of these horribly irresponsible people out there. You you we don't know, like, it's easy to judge, but at the end of the day, we really don't know what everybody's individual situation is and how they're feeling, etc., etc. You can judge and say people are being irresponsible and crowding up hospitals, and now my family member cannot get a hospital bed. But look at all those people who are irresponsible. They overeat, overindulge at Thanksgiving and Christmas time, too much sugar, and they're diabetic, and then they end up in hospital in intensive care unit with all these grave complications of diabetes, and sometimes they don't survive, right? And that's because of overindulgence at Thanksgiving and Christmas time. People overindulge in alcohol and end up in the intensive care unit with severe forms of pancreatitis, and sometimes they don't, make it and so on. So people overindulge in everything, drugs, just everything, and they get sick from these situations, end up in ICU for long periods of time, and take up the space for other people who have other illnesses as well. So who's to say that my overindulgence is not as bad as your overindulgence, right? We can't really say things like that, right? So, I think at the end of the day, if we were to mind our own business, right, and stop minding other people's business, life would probably be better. And the same with people kind of looking, oh, why are you not wearing a mask, and wanting to be screaming at people because they're not wearing a mask. I had a situation, somebody who I know personally, they were in their laundry room at home in their apartment complex, and it was them alone, and so they were not wearing a mask. They're in their home and they're physically distant from other people. And so some older man comes down and says, why are you not wearing a mask, and shouting and screaming, and you know what happens potentially if you shout and scream, in terms of what you can spew out. And then, this person I know, obviously we're ignoring them, but then the man proceeds to bar the door, right? So that the person cannot get out. I mean, what is that? Like, what foolishness is that, right? So, you are standing there barring the door and not letting this person out. And so the person is coming up and you're staying in their physical vicinity because they're not wearing a mask, but then you're being exposed in other ways. I mean, that is just not very smart, right? And so I think if we were to all just start minding our own business and focusing on what we can do for ourselves and our families and for society at large, then the world would be a much better place, right? Use this opportunity to learn something new, learn, I don't know, a new skill, or do that project you were planning to do at your home or whatever, right? And just not mind other people's business. Personally, I use the opportunity to come up with, I actually created a course to help people to figure out how to break up with sugar, basically how to stop consuming so much sugar, and with the goal to achieving overall improved health. And I actually launched that some time ago, a couple weeks ago, and actually I've spent more time with that now than on the Infectious Doctor page, because I might as well focus on helping people to optimize their health and their ability to fight disease in general, rather than infections. So I'm going to put the link to that page at the end of this video for those who are interested. But yeah, just just focus on yourself, be smart. I personally, this is the last thing I'm going to say about how I am living now, for now, in the COVID era. My family, my husband, my son, and I, basically, we hardly go out. Not because we're afraid, But really and truly, it's just not fun anymore. It's just not fun. I mean, personally, I find the mask very uncomfortable, and then people are judgmental. And so we don't really go out as much anymore. We have been to restaurants a couple times, but it's like my son, he's young, so we wouldn't go to a museum or any indoor place like that. It's so hard to keep a child from touching up everything, and then children, they can get something and then they can give it to you, etc., etc. So we're not afraid, but we just kind of don't do as much as before. We don't go down. We used to go, there's a store called TJ Maxx, which we used to go to a lot, and we just don't go to it so much anymore. Well, actually, I haven't been since this whole COVID thing. So we just kind of stay put, but I guess we have each other, so it's not that bad. Like people who live alone, it wouldn't be as easy for them to just stay put. So anyway, there you have it. Thoughts on COVID, and if you have any other questions, let me know. If you're a little shy, you can DM me the question, and I will address it as best as I can. Remember, this is general information and not specific advice related to any one person, and these are only my personal opinions. Feel free to disagree. Of course, in the world, it seems like nobody can disagree anymore. I am totally fine with people disagreeing with me. Hey, that's what life is about. I have my opinion, you have your opinion, etc. Right? So, I'm fine with that. So I hope everybody's doing okay, as best as we can be doing in this situation. And all the best. Okay? So until next time. Bye.